Hello and welcome to the fifth section of patient assessment entitled the ABCDE Survey. As always, this is Keith Woodmeyer with Wayne County EMS. After forming a general impression, begin the primary survey by assessing the patient's airway and level of responsiveness. Assessment of the patient's airway and level of responsiveness occurs at the same time. If the patient appears to be awake, start telling the patient your first name. Let them know that you're an EMT. Explain that you're there to help. Next, ask your patient, why did you call 911 today? The answer the patient will give you is important information. Sorry, I don't know what's going on today. First, it will tell you if the airway is open. Second, it'll tell you what the level of responsiveness is, or the level of consciousness. Thirdly, the patient's answers should be the chief complaint. A chief complaint is the reason why EMS was called, usually in the patient's own words. The human body must have a continuous supply of oxygen to survive. Air containing oxygen enters the body through the nose and mouth. It travels down the throat, through the pharynx, through the trachea, and into the lungs. In the lungs, oxygen is transferred to the blood. The oxygen-rich blood is circulated to every cell in the body. The cells of the body cannot live long without oxygen. Therefore, a life-threatening emergency can result if the flow of air is blocked, or if oxygen-rich blood is not circulating throughout the body. A patient who is alert and talking clearly or crying without difficulty has a patent airway. The airway is the pathway from the nose and mouth to the lungs. If the patient is unable to speak, cry, cough, or make any other sound, the airway is completely obstructed. If the patient has noisy breathing, such as snoring or gurgling, the patient has a partial airway obstruction. If the patient is unresponsive and you do not suspect trauma, open the airway by utilizing a head tilt chin lift maneuver. If the patient is unresponsive and you do suspect trauma, open the airway utilizing a jaw thrust maneuver. When assessing breathing, you need to utilize the look, listen, and feel method. Responsive patients, you're going to look and listen. Unresponsive, you're going to look, listen, and feel. Let's see. If breathing is adequate and patient is responsive, allow them to assume a comfortable position. If the patient is unresponsive and the breathing is not adequate, maintain an open airway. Use airway adjuncts such as an oral airway if needed. Place the patient in the recovery position if there are no contraindications. Provide oxygen by non-rebreather mask. Watch the patient closely to make sure that adequate breathing continues. If the patient is unresponsive and breathing if the patient is unresponsive and breathing is inadequate, or if the patient is not breathing, begin positive pressure ventilations utilizing a pocket mask. More likely, I have it in my notes because I copied that from the book, but if they're not breathing, you're going to utilize a bag valve mask device. If the patient has dentures and they fit well, leave them in place and this will help you provide a good mask seal. If the dentures are loose, remove them so that they don't fall back into the throat and become an airway obstruction. Watch the patient's chest while you ventilate the patient. If your ventilations are going in well, you should see the patient's chest rise gently with each breath. Continue breathing for the patient until they begin to breathe adequately on their own or another trained rescuer takes over. If your initial breath does not go in, gently reposition the head and breathe again. If there is still no chest rise, begin CPR. Check the patient's mouth for a foreign body each time you open the airway and give rescue breaths with a bag valve mask. Emergency care that may be needed to manage the patient's breathing during the primary survey include the following: giving oxygen, suctioning, repositioning of the airway, removal of foreign body, insertion of an oral or nasal airway, and positive pressure ventilations. Assessment of circulation involves evaluating signs of obvious bleeding, central and peripheral pulses, skin color, temperature, and condition, and capillary refills. Look from head to toe for signs of significant external bleeding. Control major bleeding if present by applying direct pressure over the bleeding sites. Apply a pressure bandage if needed. When assessing a responsive adult or a child 1 year of age or older, first check the radial pulse of the wrist. Use the carotid artery in the neck to check the pulse of an unresponsive adult or child greater than 1 year of age. Feel the brachial pulse in the upper arm in an infant. Feel pulse for at least 5 seconds, but no longer than 10 seconds. While assessing the patient's pulse, quickly check the patient's skin. Assessment of the patient's skin condition can provide important information about the flow of blood through the body's tissue. Perfusion is assessed by evaluating skin color, temperature, skin moisture, capillary refills. Emergency care that may be needed to manage the patient's circulation during the primary survey include the following: giving oxygen, patient positioning, chest compressions, and bleeding control. Altered mental status means a change in a patient's level of awareness. Altered mental status is called an altered level of consciousness, or an ALOC. Common causes of altered mental status can be evaluated by utilizing the mnemonic AEIOU tips. A stands for alcohol or abuse. E stands for epilepsy. I stands for insulin, implying diabetic emergency. O stands for overdose, or lack of oxygen, for hypoxia. U stands for uremia, such as kidney failure. T stands for trauma, such as a head injury, or temperature, fever, heat, or cold-related emergency. I stands for infection. P stands for psychiatric conditions. Second P stands for poisonings, including drugs and alcohol. And S stands for shock or stroke. When evaluating disability, we utilize the Glasgow Coma score. And assess 3 categories. We assess eye-opening, verbal responses, and motor responses. Glasgow Coma scores is the sum of the scores in the 3 categories. When we're evaluating eye-opening, the ratings can be 4, 3, 2, or 1. 4 being spontaneously open with blinking, 3 being response to verbal commands, speech, or shouts, 2 being response to pain, and 1 being no response at all. And verbal responses can be 5, 4, 3, 2, 1. 5 being oriented, 4 being confused but able to answer questions, 3 being confused and answers with inappropriate words, 2 being incomprehensible sounds, and 1 having no response. And for motor, we have 6, 5, 4, 3, 2, 1. 6 being obeys commands, 5 being purposeful response to pain, 4 being withdrawals from pain, 3 being abnormal flexion or decorticate posturing, 2 being abnormal extension or decerebrate posturing, and 1 being no response. The lowest score that a patient can receive in a Glasgow Coma score is a 3. Emergency care that may be needed to manage a patient's neurological status during the primary survey include the following: maintaining an airway, giving oxygen, ensuring adequate breathing, suctioning, patient positioning, and spinal stabilization. When assessing a patient, you can't treat what you don't find. Expose pertinent areas of the patient's body for examination. Factors that you must consider when exposing the patient include protecting the patient's modesty, the presence of bystanders, and environmental/weather conditions. Removing the clothing of a medical patient may reveal a medical identification bracelet or necklace, implanted pacemaker or defibrillator, surgical scars, swollen tissue, or other important findings. Removing clothing of a trauma patient may reveal injured areas that would otherwise go unnoticed. Clothing that might impair patient movement, respirations, or distal circulation should be removed. Remember to keep the patient warm. Identifying priority patients. After completing a primary survey, determine if the patient requires on-scene stabilization or immediate transport with additional emergency care en route to the hospital. Patients who require immediate transport, often referred to as a load and go, include patients who give a poor general impression, unresponsive patients, responsive patients who cannot follow commands, patients who have difficulty breathing, patients who are in shock, women who are undergoing complicated childbirth, patients with chest pain and systolic blood pressure less than 100 millimeters of mercury, patients with uncontrolled bleeding, and patients with severe pain. And this concludes the ABCDE survey section.